Hey everyone, I'm Stacy Greiner. I'm an assistant professor at the University of North Texas Health Science Center. I've been in Texas for about 6 years now, and I'm currently working a lot on congenital syphilis screening, but any kind of sexually transmitted infections, really. So thanks for being willing to be a member of our planning board. I'm going to give you some information about the study and just give you a big overview of what it's going to look like for you and what you'll contribute as a member of the planning board. The study title is kind of long. It's called Multi-Level Determinants of Prenatal Syphilis Screening Policy Implementation. It is a 2-year project. It will be expanded to 3. So we're about almost done with the first year, but still in a good place to finish the study on time. It's funded by the National Institutes of Health, and it is specific to Texas. So Texas is a context we're working in, and everyone we talk to will be from Texas. So I'm the principal investigator. The grant is housed here at the Health Science Center. And I have some really great co-investigators that I work with. So I'm a researcher, not a clinician. And so that's why I've involved some of these people. So P.A. Brosnan, she is also at the Health Science Center, and she focuses on sexual and reproductive health mostly. Dr. Malini Neelamigam is an epidemiologist, and she does a lot of community-based work, specifically around infectious disease, which is why she's here. And Dr. Megan Nelson is an OBGYN. So all really great experience and kind of round out the research team. Sophia Garza is my incredible doctoral student who will be working with us on this project. So how we got to congenital syphilis, specifically in Texas, is that our rates have been increasing pretty significantly over the past few years. And in response to that, in response to Texas rates being much higher than the US average, in 2019, Texas modified the health and safety code that they use to recommend syphilis screening during pregnancy. So before that, there were recommendations of screening at the first prenatal care visit and then again at the 3rd trimester. After 2019, it switched to adding another screening point at delivery. And so that's a pretty big change. It seems like after having talked to a lot of clinicians, there's still some kinks to work out into implementing this into their clinical practice. So making sure that everyone gets screened again at delivery. So that brings us to this project. The long-term goal of our project is to get more people screened for syphilis during pregnancy, ultimately hoping to reduce congenital syphilis in Texas. And our objective is to identify implementation strategies to facilitate the translation of that policy into practice. An implementation strategy is basically the plan to do translate this research into practice. It's kind of like the how when you're thinking about it like that. And that's where you come in as a planning board member. So we do have 12 people on the planning board. Like I said, I'm not a clinician, so I focused on recruiting a bunch of providers who can help inform what we're doing. So I really get a clinical perspective as well. So 8 obstetric providers across disciplines. So 2 physicians, 2 nurse practitioners and PAs, 2 certified nurse midwives, and 2 RNs. And then we also have 2 clinic administrators. Since this policy change is happening in the hospital, we really want to talk to people who might be nurse managers or clinic administrators in that area. So 2 people who represent them, and then also 2 prenatal patients so we can get that information as well. They've been pregnant in the past year, so they have really recent experience with congenital syphilis screening. And I'm budgeting, recommending, or guessing that it'll be about 2 hours of your time in year 1, pretty small commitment. And then it's a little bit more in year 2, about 4 hours. You're compensated $100 an hour for your time, and that will be coming through Amazon gift cards. So if you have any concern about that, or you'd like a different method of payment, let me know, and I'm happy to work that out for you. So there's 2 aims to the study. The first one is to basically figure out what's going on. What are the barriers and facilitators to implementing this new policy into practice? And how we're going to do that and gather this information is through 45 interviews. And we're going to get information from physicians, other clinicians, clinic and hospital administrators, and pregnant patients. So a larger sample of what the planning board is comprised of. And we're just going to ask a lot of questions. Our questions will be guided by this framework called the Consolidated Framework for Implementation Research. It's a huge framework, so I won't go into it here, but it helps really organize the barriers and facilitators that we might see and helps kind of guide some of the questions I'll be asking. And then the research team and I will conduct a thematic analysis and pull out the results from all of those interviews and kind of make sense of what we found. So that's all for aim one. For aim two, we'll be working on developing the implementation strategy. So now that we know the barriers and facilitators, how do we successfully implement it into practice? So this will be a partnership between the research team, the co-investigators that you saw earlier, and the planning board. And it's going to be a few rounds of feedback. So how I see this is we'll first present you with the results that we found. Maybe it's a sheet, an overview. We could get into depth and more in depth about something. Just give you an overview of what we found. And then I think it will probably be surveys first to rank the most important ways that we can address these barriers. And then maybe some more feedback and potentially a focus group meeting or a group meeting at the end of the project to make sure we all are on the same page and headed the right direction. All of this will be virtual and most of it will be asynchronous, so you can do it on your own time. And our goal here is to identify the best implementation strategy and get ready to put it into practice in the next project. So what does your role look like? In year one, with the 2 hours, what I'm hoping for is for you to provide feedback on the interview guide I've developed. I will send it via email probably mid-June. So over the next couple weeks, I'll send it to you. And I'll give you 2 weeks to review it, provide some feedback, and you'll just email it back over once you have done that. If you need more time, just let us know. We're happy to work with you. And then once we have the interview guide finalized and we're ready to conduct the interviews, I'll have a nice flyer. And I hope that you will share this material with your networks and help us find people who we can talk to gain the information. What I think is really great about the planning board is I'm in Dallas Fort Worth. A lot of you are all over the state, and I might not have connections there. So I want to make sure that we're gaining information from everyone we can, and that includes diversity in location. So I'm hoping you will help with that. And then in year two, like I said, you'll review the results from the interviews and complete a few surveys to identify the best ways to address the barriers, and then potentially have a virtual meeting. I will always keep you up to date on how this is shaking out and how it develops. I think it's going to be a really fun project, and I'm looking forward to it. And of course, I just want to say thank you for your time. I really appreciate you being willing to serve on this planning board. I'm excited to hear your input, and your feedback is really valuable. Like I said, you're bringing a lot of experience to this that is not represented in our investigator team. So please feel that your thoughts are valuable, and we would love to hear them. And if you have any questions, feel free to let me know. But I'm looking forward to working with y'all, and I will see you soon. Bye.